Janet. How are you?
Hi, how are you? Great, thanks. Thanks for having
I should thank you because I was very, very excited when you said yes to coming on my channel and doing an interview. I know that you're very busy and we're doing this over the weekend because you're back to the office doing physical therapy face-to-face with clients, correct?
Yeah, so 5 days a week I'm back in the clinic. We had a 4-week period of time where we were doing telehealth, seeing patients basically the same way I am right now with you.
Right.
And we were doing PT that way, which was a little different, but we survived and we kind of worked through it. A little bit harder to do some stretches, and sometimes people need mobilizations. That's harder, but we did what we did the best.
Yeah, right. You did the best you could under the circumstances. So for people who may not be familiar with obviously who you are, guys, she's a very good friend of mine. So yeah. Yeah. But why don't you introduce yourself and tell us a little bit about how you became a physical therapist?
Sure. So my name is Janet Celentana. I'm a physical therapist. I have my master's in physical therapy from the University of Kentucky. Way back when I got my degree, there was no such thing as a doctorate in physical therapy. So that was the highest awarded that you could get at that time. So I haven't gone back for my doctorate just because I'm doing fine with the way things are, and really I feel as though I can learn everything I need to learn just with my continuing education courses. So why I became a physical therapist, it's just a great fit for me. Just everything about it I love. Just helping other people and solving problems as far as injury and getting them back to full function. It's a great fit for me. It's a great career.
Right. And you're a runner as well. I know that that's right, because I see you on Instagram. We haven't run. Well, I think with COVID it's a little bit more complicated to run together. But how did you start? I think you started running like way back, like in college, didn't you?
In high school, I've been running since I was 14. Reluctantly, when I was 14, my very close friend pulled me in. And actually, it was really unfair because the cross-country coach in my high school called me before I ever stepped foot in my high school and recruited me. She took an hour. It was insane. But I really liked my cross-country team. I was a much bigger runner then. Just full disclosure, right now I consider myself like a very casual runner. But I've been running since I was 14, and I took about 10 years off in my 30s. I just was kind of done with it, but then I missed it. So I'm back. But I would say I run 3 days a week, sometimes 4, with my dog, no more than 3 or 4 miles. And while I feel very proud that at one point I ran a 21-22 5K, there's no way I could do that now. I was like 20 pounds lighter and in much better shape. So I would like to be there, but I'm not there now.
Right. Do you have any curiosity about like running races at all, or?
Every once in a while, I do the races that are, for fundraisers and things like that. And I have done a few here and there. I'm in the high 20s, which is tough for my pride, but I have to give myself a little bit of slack, or just a little patience that you can't just jump back in and be where you were. So
right, that's important too. I wanted to also touch on what kinds of patients would come to your clinic. Like typically, why would you see a new patient?
They can come for any wide range of reasons. Right now I work for Rothman Orthopedics in Pennington, New Jersey, and most people who walk into my clinic are orthopedic in nature, which is my preference. I love that group. So really anything related to joint or muscle injury, I can help with. And that is in the spine, in the knee, in the ankle, in the shoulder, any extremity or spinal. So that's really why people would come, is if they're having pain, usually with movement, sometimes because of lack of movement. Now that we're in a pandemic, I'm seeing many more issues because people are sitting more and not moving as much. They just don't have the opportunity. So really, anything related to joint or muscle is appropriate to be seen by a physical therapist.
Right. So are you seeing patients that go to the doctor first and you have some sort of idea what's happening to them, or do you diagnose the
A little
issue?
bit of both, because the reality is that the doctor is basing it on what they see at that moment and some x-rays and possibly tests and things like that. And then a lot of times in the week or so that has transpired since they saw the doctor, sometimes the symptoms have drastically changed. So they might have hip pain when they saw the doctor, and the diagnosis was hip arthritis based on an x-ray and some of the history that the doctor took. And then by the time I see them, they have radiating pain to their ankle. Well, the doctor would have never given them hip arthritis with that symptom, knowing that they've got radiating pain, numbness, tingling into the feet. So there's a little bit of, yes, the doctor's already done a preliminary, but then of course you have to look at the person who's in front of you and decide, does that match up? Do the symptoms still match what the doctor said? So it's a bit of diagnostics, but also, of course, the orthopedic has an important role in this, especially in the United States. Now, you don't have to see an orthopedic first to see a physical therapist in the United States, in most states, but your insurance company may or may not pay for it. So there's that piece.
So when would you recommend someone to call you?
If we're talking very mild pain and it's really not affecting their function at all, they're able to do everything, but it's sort of this nagging pain, people can let that go a little while longer and just kind of monitor it and be certain that it doesn't get worse. But, I don't think as medical people we give athletes and people enough credit of listening to their body. So you'll know when something gets worse. You'll know, you'll get a sinking feeling that things are getting worse and worse, and maybe I should get this checked out. So I would say it varies. If it's a high level pain, you should get it checked out sooner than later. If it's minimal and you're able to do everything normally, it's just a little nagging something, you can hold off a little bit on that, whether that be a week for what you're comfortable with, or a month. But I've definitely seen people hold off for years, and that's a little on the long side.
Right. You never should let it go that long.
Saw someone this past week, and he was like, "Yeah, it's been 7 years," and I thought, "What?" So that's not ideal.
But it makes you wonder. It's probably not 7 years with the same kind of pain. It's probably something that's on and off.
On and off, absolutely. But nonetheless, it seemed like it was on and off.
It's a long time.
So I wouldn't let it go 7 years, but yeah, that's me.
So I asked my people who follow me on Instagram, on Twitter, to ask questions, and we had a wide range of questions. One of them was, what's one of the most typical injuries that runners experience?
So I would say the calf strain is probably the biggest one. The Achilles, calf strain, muscular in general, that's probably the most common, and the one I probably get the most questions.
Is there a difference in between, because there's different kinds of runners, obviously. There's people like myself, I do more like longer distance, as opposed to people who do more like doing like milers, like more sprints and like speed workouts. Is there a difference in between both? Like people who decide to, run a marathon, or like longer than a marathon, and then shorter distances, or not?
Yeah, of course. The form is different. With the sprinters, you're looking for more explosive power. You're going to get a lot more muscle strains with the sprinters and a lot more overuse strain with the distance runners. So where the sprinter might be trying to lengthen their stride and get a strain because their muscle has been expected to stretch and then strength and then tighten at the same time, which often causes tearing. The distance runner will have more of an overuse, like tiny micro tears causing inflammation and then setting them kind of up for this cycle of inflammation, where the sprinter will have a pretty bad sprain that they really won't be able to function, and it'll set them back, and then getting back out of that is pretty difficult for both of them. The trajectory is similar because when you're dealing with muscle repair, it's a long, steady road back. It's not just rest. You have to stretch it. You have to progressively load it without sending it into an inflammatory response, which is very tricky. And it's about listening to your body and often having a therapist or a trainer guiding you to help you achieve that appropriate amount of progressive loading, meaning challenging that muscle to the degree that it needs to be challenged so that it can remodel stronger. So if you do too little, it's not going to get better. And if you do too much, it's going to keep in that inflammatory cycle, which you don't want.
Right. Okay, so another question we have is how to manage sciatic pain issues.
Okay. So
this one surprised me because my audience typically are runners, and I didn't think runners had so much sciatic pain issues, but maybe it's just that, you know, I haven't met anybody with that issue.
So, you know, it's funny. The thing that's so funny about this question for me is that you know a runner by the fact that they're asking, what can I do for the sciatic pain when I run?
Okay, so that's how both things relate.
If they have sciatic pain.
Right. That was what shocked me. Yeah.
So I think the biggest thing with sciatica is, first of all, once you have it, understand that this is a nerve that's being pinched. So it's nothing to take lightly, and you probably want to see somebody pretty quickly if it's not gone within 2 weeks. So a lot of these sciatic issues resolve within 2 weeks on their own, just doing your normal functioning. If that's the case, great, fine, continue back to what you were doing. Watch for weaknesses though. And I'm going to go off on a tangent for 1 second. Because I only run 3 times a week, it's because the other 3 days I'm strengthening. And that's one of the things that I really changed when I came back into running in my 40s, is that strengthening became a big piece of this. It's definitely helped with injury prevention. It definitely helped with form and just me feeling better about being a runner in general. So back to the sciatica, one of the things with sciatica is that you're aware of the pain, but there's also some weakness that can come in. I treated a runner a long time ago, and he had no idea that he wasn't able to raise up on his toe on his one leg. The other leg was basically compensating for the one that wasn't working. And we traced it all the way back to 5 years prior, where he didn't have any pain with the sciatica, but he had his 5K time dropped 5 minutes in like a month.
Oh,
so
wow.
Little bit funny, and basically what was happening is he was no longer getting push off on one leg. He was propelling himself with one leg every race. So he lost that strength. He had weakness in one leg for 5 years. And at that point, it was too late to really gain that back. So that's what I would caution you with sciatica, is that understand it's a nerve, and the pain and the numbness and the tingling, that's a sensory issue, but there's often a muscular issue or a strength issue that goes along with that if it goes on too long. And you don't want to mess with that, because once that electricity to the muscle is turned off for a period of time, it's hard to get back, if at all. So I wouldn't take sciatica too lightly. That being said, there's lots of things to prevent it. Stretching, things like that, but also being aware of your form. As runners, we tend to pitch forward, so we tend to lean a little bit, and understanding that we then have to stretch back the other way. So one of the big stretches that I do are kind of like that cobra stretch, where you arch backward while you're on your stomach, just to undo all that forward bending that we do. A lot of runners love that hamstring stretch, but they round their back rather than keeping their back arched and like hollowed out in the back. And really, your hamstring isn't being stretched when you round your back. That's your sciatic nerve. So you want to stay away from that. You want to keep your hamstring flexible by keeping your back out of it and just bending at the hip, which is a little bit hard to differentiate. Does that make sense to you?
It does.
You're getting a hamstring stretch, but you're also stretching the sciatic nerve. And the downside with that, and of course, I should probably have said this early on, if you ask 10 physical therapists, you're probably going to get 10 different answers. So take it for what it's worth. But in general, I don't think you really want to stretch that sciatic nerve as much as we think you do. It could be pulling on a lot of things, and as you round your back forward, you could be putting your discs at a disadvantage, or at least at risk. And I don't know if you want to do that too much.
Okay. How to get rid of IT band issues, and should you still run? This is one that I actually know a lot of people have, and I this is the only injury I've ever had. I had issues with my IT band after Philadelphia Marathon on my right, but then they went away. I continued running, but I mean, it was not a thing that really, it bothered me, but it's not like I had to take ibuprofen, or I just kept going with my life. It's just not run less. But I know it sidelines people a lot.
Sure. So there's a couple of things with the IT band, and this is really where the physical therapists watching are probably going to cringe, but that's okay. You know, we all have our own way. And really what I say is that, you know, if 3 people give you directions to your favorite restaurant and you follow all 3, it's going to take you a lot longer. So just pick one.
Right.
So here's the thing. First of all, IT band, in my opinion, may be overdiagnosed because, you know, Dr. Google is often guiding us that way.
Right.
It happens to be the L4, L5 distribution of the lumbar spine. So I'm going to stand for a second so you can. So basically, from here to here, there's a nerve that is often aggravated when we do certain things. Now, that's not to say that the IT band is never involved. It can be involved, but when it is involved, what it does, that muscle, is it moves the leg out like this, okay?
Okay.
When you're standing, it keeps your hip from dropping like this on the opposite side. When you're standing on the right side, it keeps your pelvis stable. But that's the secondary muscle. The first muscle is your glute medius. It's all the way in the back here.
Okay.
And the reason that that's important is that if your glute medius is not working properly, the IT band kicks in to help, okay? The IT band can lift, I'm just gonna take a generalized guess across the board, about 10 to 15 pounds, 20 pounds. The glute medius has a lot more force, has a lot more ability to lift heavier loads. So basically, if one muscle isn't doing the job and the IT band has to take over, that's why it gets irritated and aggravated and injured. So really, the IT band is basically the worker who doesn't have the credentials, that's doing all the work in the office when the person who's really in charge isn't doing their job. It doesn't work very well. It's not very efficient. It's taking over the job, which is basically not designed to do. So this is a long story, but basically, usually that glute medius is a problem because of the low back. So with the IT band, it's hard to know, is it the IT band pain, or is it the pain from the low back that's going down the thigh? It's hard to know because really oftentimes the IT band problem is coming from the low back to begin with. So you have to fix that first, build up the glute medius muscle, and then the IT band can calm down and not have to do its job. The reality is when you're treating the low back as a result of this IT band problem, you don't know if the referral or the IT band relaxation is causing the symptoms to go. But at the same time, I'm not certain it matters.
Right. If they're gone, if it's not hurting, right?
Yeah. So I guess the reality is often the IT band problem is a symptom of a bigger weakness in the glutes, which again points to strengthening.
Right. And I think that's, I think most runners would agree that our glutes are always weak. I mean, the more distance you run, the more you notice that your glutes are weak. Yeah.
Yeah. And
it's a
really,
constant battle.
You may or may not realize this, but your glutes, every time you land, your glutes are trying to keep your pelvis stable and even so that they don't rock. I'm sure you've all been behind runners whose hips just rock the whole time. Those people have a glute medius problem. Sometimes both sides, or maybe only one side does it, and they're going to set themselves up for IT band problems and a whole bunch of other things. So that being said, with the IT band, a lot of people are like, oh, well, how can I fix that? How can I stretch it? To be quite honest, I would just roll it. I would just take one of these little rollers and just roll the IT band. To stretch it is so complicated, and you're going to actually move the pelvis and the low back with it, potentially in ways that aren't going to be beneficial. So I'm not saying you should never stretch the IT band, but that's not where I would focus. I would focus on rolling it instead.
Okay. This one was very interesting. How much does proper shoe selection factor into the probability of long-term injury?
It probably factors a lot. That being said, I'm going to have to defer slightly to the shoe experts. I don't really know shoes that well. I'm going to be honest about that. What I do know is that I tend to walk on the outside of my feet, which means I'm a supinator, which means there are only a few shoes that I can wear because almost every running shoe is made for people whose feet roll in. Mine don't roll in, and the last thing I need is something pushing me further out, because basically that's going to cause me to have ankle sprains. So I have shoes that allow me to supinate. I think in the shoe world that's called, in PT world it's called inversion. I invert my ankles. In the shoe world it's called supination. Most people evert, and in the shoe world I think it's called pronation. So overpronators, right? So just know what you are. And the easiest way to tell what you are is to look at your favorite pair of shoes. On the bottom, you'll look at the heel on the back, and you can see, is the outside more worn or the inside of the heel more worn, or are they even? And if they're even, then you're a neutral. Then you're neutral, and pretty much you just need a pretty good shoe that doesn't evert you or invert you, doesn't supinate or pronate.
So, but can you get injured if you're wearing the wrong shoes? Like if you run a full marathon on the wrong shoes, can you get injured?
Sure. Like if I wore a shoe that was constantly pushing myself to the outside and I ran a marathon, the likelihood of me spraining my ankle during that marathon is high.
Okay.
So what I need to do is roll in.
Okay. Now we have a question about compression socks.
Okay. Yeah.
Are they effective for injury prevention and recovery? And the person who asked this question said, I just got over a calf injury, no diagnosis. I just rested and wore compression socks until it felt okay to run again.
So compression has been shown, there's a lot of newer research right now showing compression decreases the blood flow to the muscles, which actually causes increased strength for the amount of load. So right now in PT, one of the big things is putting blood pressure cuffs on the muscle following surgery to constrict the blood flow, ask them to do some low-level exercises, and what they're finding is pretty amazing, that the muscle is getting a lot more strength and a lot more girth from a low-level exercise with the compression on the muscle. So it's kind of counterintuitive that restricting the blood flow and then asking the muscle to do something is actually having significant benefit. That being said, this is new. So anytime there's something new, we don't know what the long-term effects are.
Right.
I would always defer to what you feel. Like if your body is telling you this feels good, this is what it needs, and you're getting better and better and better, great. If something doesn't feel right, clearly if your legs are turning black because you don't have blood flow, that's bad. I mean, I know most people would never let it get there, but you know, there is some risk with decreased blood flow. So it's not really to be taken lightly, but if you're seeing positives and you're being honest with yourself and listening to your body, you can tread lightly into that area.
So another question, it came in Spanish. I'm going to translate. Advice to treat an Achilles tendinitis. It's a friend of mine who has, this is a recurring injury. So the way he's treating it, it's with anti-inflammatory, lotion, and he's icing it as well.
Okay.
But he's had it for a while.
So the struggle with Achilles, it's a muscle, first of all, right? So it's the tendon. A lot of people get picky about that, but the tendon is the end of the muscle. It attaches the muscle to the bone. So the tendon tightens and contracts and stretches just like the muscle does. It's part of the muscle. It's the end of the muscle. So what that means is that when you're talking about getting an Achilles tendon or the calf muscle to recover, just like I said earlier in this, rest is only good for a short amount of time. Maybe a few days, maybe a few weeks, depending on how bad the strain is or the pain is. Once you get past that initial aggravation or irritation and you're trying to get back into your function, it's finding that balance between doing too much and too little. If you do nothing and then ask it to say you're at a 0 level and you go all the way up to a 10 level, that's where a lot of people get into trouble. Where you really want it to be like a staircase. Each day a little bit further, or each week a little bit further. If it's a really bad injury, you have to be very patient. It is helpful to have a PT, a doctor, or a personal trainer monitoring this. But in general, basically what you can expect is a little bit of pain with running, but nothing more than a 2 or a 3, and then a day off to recover. And then kind of slowly increasing your ability, letting it have a little bit of pain, because with muscles you're going to have that, but not letting it go into the point where then you have pain for 3 straight days. It's very tricky. There's a lot of research out there. I did send you that one article that I think is really helpful. It's a bit academic, so it might be a little bit more than people are willing to learn about or chew on. But in that article is this great graph about how much you should allow your pain to climb to during an activity. But when you're rehabbing muscles, they're going to be sore. And so it's just finding that right balance of allowing it to get a little sore, but not so sore that it sets off the inflammatory response. And that's a really, really tricky thing. I would say it's probably the hardest thing to do yourself. My own personal Achilles story, it took me about 6 months. I'm sad to say. But that doesn't mean I wasn't running the whole time. It just means I had to deal with my ego and just stop when the pain got above 5 out of 10 and walk the rest of the way and be okay with 13-minute miles. Oh my God.
Which for some people is, you know, there's nothing wrong with 13-minute miles.
Twice what I did in high school.
Oh,
you know, it's
yeah.
hard, but the reality is when you've got an injury, it's checking your ego at the door, right?
Right.
Otherwise, you're just going to sabotage the process.
Right. And I know this particular friend of mine, he runs a lot on the beach, barefoot.
Oh,
is that good or bad?
So, okay.
Because you know, he runs on uneven.
What you have to understand about running on the beach, and this is actually this is a good point. So people will say, oh, isn't it so much better to run on the grass for your joints? It's harder on your muscles. And that doesn't mean bad for your muscles. It just means you might be more likely to strain your muscles if you've been running on the road and then decide to run on a trail or on like some slushy, grassy trail, right? Or even if you go from the hard road to like a really soft track, your muscles are going to feel that. It doesn't mean it's bad. It just means that they may or may not be ready for the amount that those muscles have to work compared to a road. Now, the road puts a lot of strain on the joints. So It depends on what your issue is. If you've got some joint knee pain that's really bothering you, then running on a soft surface could really give that joint a little bit of a break. But your calves are going to be sore and your quads are going to be really sore. So does that make sense to you? So running on the sand is a soft, pliable surface, great for his joints. His joints are going to love him for that. His muscles are going to work twice as hard. Maybe not twice. That might be an exaggeration.
But they're going to work harder.
Yeah. So if he's got a muscle problem, it's fine as long as it's the appropriate
stimulus, right? Like he's not overdoing.
Yeah, it can't be over, it can't be under, it has to be that. Yeah.
But that's like anything else. If you have if you want to, you know, perform really well in a race and then you have this issue like the week before, it's up for, you know, like at the very least you're going to be concerned. Right. You don't want to be stressed right before a race.
I think that makes me think of what I do find it in runners especially is that they underestimate rest. And when I say rest, I don't mean that I'm resting on the couch. So I consider my rest days Monday, Wednesday, Friday when I'm doing squats and I'm doing glute and hamstring strengthening, or I'm doing arm strengthening, or I'm doing the rower, or I'm biking with my family. Those I consider my rest days from running. And then when I run, I rest from lifting. So rest doesn't always mean sitting and doing nothing. It just means that I think runners have always been taught by their coaches that the way you become a better runner is to run more. And I'm not certain I 100% believe that that's true. That's how I was taught, you know, run 7 days a week or maybe take off that 7th day. But I feel as though if you're looking for general health and well-being of your muscles and probably even speed in the races, I think building up strength is a big thing, and giving yourself that time to recover, because a lot of rebuilding happens in that day that you're taking off and doing something else. So basically cross training, right?
Right. That was a good reminder of, you know, how important cross training and allowing yourself and sleeping, right? You have to rest.
Yeah, definitely sleeping.
That's a big one too.
Yeah.
So the next question, what are the top 3 recommended stretches for runners.
Okay. So again, I think if you ask 10 physical therapists, they'll give you 10 different answers, but I will tell you the ones that I use. So just, keep that in mind. First and foremost, the quad stretch, right? So this is pretty ideal. The key with this one is, I'm sure you've seen people do this. It's not forward, right? The hip has to be extended and the knee is flexed as much as possible. Now, I know there's going to be people out there that are going to be like, what about that hamstring? Of course. So let me just demonstrate that, the hamstring with the back arched as much as possible. And that's it. I don't have really good hamstring flexibility. I know someone just gasped again, but the reality is if I'm keeping my back straight, my hamstrings don't move that much, but my quads don't either. So they even each other out. I'm generally not very flexible. I also want to show you my second favorite, which is the calf stretch. So standing on my couch, sorry. But basically, you drop your heel off the end of a step and push up and drop down like that. This one's super, super important for that Achilles. You can do knee straight and knee bent both. And that's, I would say, of all the stretches, that's the one I need more than anything, unless I'm considering my low back stretch, which for me, with what I do, leaning over patients all day and then coming home, and basically our whole lives are forward. I don't know if anyone's really thought about that, but laundry, dishes, cooking, we're never standing upright cooking. We're always leaning slightly forward, right?
Right.
So, and I'm leaning over my patients. And so when I run, this is the stretch that I do probably more. It's the most important one for me, pushing up like. Now, if I, for whatever reason, am too lazy to get on the ground or on a bench like this, then I can try to do it standing like this. Or if I get the sense that things are bothering me, I'll just lean back like this when I'm running, like at a red light, or if things are really, really bad, that's when I'll just stop and say, let me stretch first. So those 3, the quad stretch, and really, this is a low back stretch, but it also stretches the top of the quad, the front of the hips, and then the low back. It sort of evens your pelvis, things like that. Those, and then the calf stretch. Those 3 are probably my top.
So I see people doing, this is a question I have right now. I see a lot of people doing the stretches before they run. Is that good or bad? So
hopefully everyone remembers Michael Phelps. I know it's a Olympic year, so we didn't get to see the swimmers this year. But Michael Phelps is a perfect example of the type of stretching you want to do before a run. It's a dynamic stretching. So similar to the one that I was just showing you off the couch, it's a drop into the stretch for a second or two and come out of it, drop in and come out of it. You're not going to hold that stretch. The basic idea is this. When you stretch and hold a muscle, it relaxes, right? Fantastic. That sounds great. Now, imagine you've just been relaxing on your couch for a half an hour. How easy is it to transition into a high level activity from resting on your couch?
It's hard.
Easy. Yeah.
Right.
You're asking your muscles after you've held that stretch for 30 seconds, 3 times or whatever, to then go into a high level exercise. It's really putting your muscles at a disadvantage. So pressure on, pressure off cadence is probably best. You're going into the stretch, coming out of the stretch, going into the stretch, coming out of the stretch is best before. There's also a lot of functional stretching that you can find online, like high knees and butt kicks and open gates. You'll see them a lot in soccer players. They do a lot of dynamic stretching and hardly any of the holds before games.
Great. So thank you.
Yeah, of course.
We don't have any more questions. I wish we had more. Thank you so much for being here. So are you guys taking new patients at your clinic?
Yeah, we're taking new patients. Yeah, absolutely. Yep. So,
okay. So I'll put the link below.
Okay.
Where you are. Obviously, I have a very international audience, so I'm not sure how many people are local. But
yeah, don't fly in for an appointment. I think you'll be disappointed.
But guys, if you're in New Jersey, central New Jersey, that's where Janet is. And thank you so much. This was awesome. This is like a luxury to have someone like yourself come here and answer so many questions.
Sure, absolutely.
So,
be patient with yourselves out there, runners. I think that's the thing.
Thanks so much, Janet.
Thanks. Bye.
Have a good day. Bye-bye.